Hi, I'm Dr. Judith Gorra. I'm a pediatrician working with the state of Delaware in the Division of Public Health, and I'm here today to speak with you about COVID-19 vaccinations for children 6 months and older.
Why should I get my young child vaccinated?
It's important to vaccinate children to basically keep them healthy. As we all know, there are many illnesses out there and many vaccines to help prevent children from getting ill. COVID vaccination is no different. COVID in itself is an illness that can cause severe illness in children, hospitalization, and sadly even death. The use of the vaccine has been shown to diminish the severity of the illness and in doing so improve the child's quality of life moving forward.
What are the differences between Pfizer and Moderna?
The Pfizer and Moderna vaccines are both messenger RNA or mRNA vaccines. They differ in the dosing, if you will. The dosing of the Moderna vaccine is 1/4 of the adult dose of the Moderna vaccine. It consists of 2 vaccinations, one initially given and one given 28 days later. The Pfizer vaccine is a 3-dose vaccination. It is 1/10 the adult dose of the Pfizer vaccines for adults, and again is given in a 3-dose vaccination series. The initial dose followed by one 21 days later, followed by a third 2 months later. Both the vaccines have efficacy against COVID-19. However, it's based on the effectiveness in that child's age range. For example, the Moderna vaccine has efficacy of about 51% in children 6 months to 2 years, whereas the Pfizer vaccine for 6 months to 5 years of age has an efficacy of about 80%. The dose of the vaccine is based on the child's age, not their weight or their height also.
Where can I get my child vaccinated?
The vaccine is available throughout the state. However, Pfizer is readily more available at this time. Moderna will be coming, however. There are various state clinics that provide the vaccine, but you may want to check with your pediatrician and or family practitioner or primary care provider to see where, if they are not giving the vaccine or providing it to their patients, where they would recommend that you go to obtain the vaccination.
What are the side effects?
The side effects are variable, but similar to other vaccines. Side effects most commonly seen are redness, tenderness, some swelling at the site of the injection, other things such as fever, which is not as common, irritability perhaps, or fatigue, a little bit of loss of appetite. Some have even seen chills and muscle cramps secondary to the vaccine. However, the side effects are short-lived and usually resolve within 2 days or so.
How do I know this vaccine is safe for my child?
The vaccines have been studied intensively throughout the time that they've been developed. About 6,300 children were involved in the Moderna trials and 4,500 in the Pfizer trials. They have been studied, as you know, for months at a time, given the fact that Pfizer initially presented to the FDA their criteria or their information about Pfizer, but they pulled it back, realizing that they needed to do more studies. This, to me, tells me that they're really looking at the safety and efficacy of the vaccine. And in doing so, at this point, it has been proven to be both safe and effective in children ages 6 months and above.
My child has already had COVID-19. Why should I get them a vaccine?
Although your child's had COVID, the immunity from the natural disease does not last long, that we know. Giving the vaccine in addition to having natural immunity just simply boosts their immunity to having any additional COVID infections.
If I get my child vaccinated now, will they be prepared when school goes back into session?
That's the hope that we'd like to see. The more children that are vaccinated now, the better the chances are that they can participate in school and after-school activities and family activities and gatherings without any concern for the possibility of getting severe COVID if they get COVID at all. For infants 6 months and above, daycare or child cares in themselves would provide, again, a possibility for children to get infected. The use of the vaccine is there to prevent them from getting infected at all, or if they do get infected, to have less severe infection.
By getting my youngest child vaccinated, does that offer the rest of my family more protection against COVID-19?
That's a good question, and indeed it does. To vaccinate one person in a household is wonderful, but to vaccinate two, three more, the entire family and household, is even better because you can spread this illness from one person to another. So vaccinating your child and then leading forward, vaccinating yourself and others in the family is simply going to protect them all.